Have you ever experienced a persistent burning sensation in your upper abdomen, especially when you're not eating? If so, you might have encountered one of the most common gastrointestinal afflictions, gastric ulcers, also known as peptic ulcers. These painful sores that develop on the stomach's lining or upper small intestine can disrupt your daily life and require immediate attention. Gastric ulcers, also known as peptic ulcers, are painful sores that develop on the lining of the stomach, upper small intestine, or esophagus. They can be caused by various factors including infections, lifestyle choices, and certain medications. In this video, we'll explore the top 10 medications commonly prescribed in the United States that have been associated with gastric ulcer development. It is important to note that while these medications can increase the risk of gastric ulcers, not everyone who takes them will experience this side effect. Always consult with a healthcare professional if you have concerns about your medication regimen. Disclaimer: the information provided in this video is for educational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have watched in this video. Gastric ulcers can present a range of symptoms, which may vary in intensity and duration. Common signs include a burning or gnaw pain in the upper abdomen, typically between meals or during the night. The pain can be relieved temporarily by eating or taking antacids. Other symptoms may include nausea, vomiting, unintended weight loss, bloating, and a feeling of fullness after consuming small amounts of food. In more severe cases, gastric ulcers can lead to black or tarry stools, indicating gastrointestinal bleeding. It's important to seek medical attention if any of these symptoms arise, as prompt diagnosis and treatment are crucial to managing the gastric ulcers and preventing potential complications. Let's take a look at the top 10 medications that can cause gastric ulcers. Stay tuned until the end because the last one will shock you. Number 10. Non-steroidal anti-inflammatory drugs. NSAIDs are widely used over-the-counter and prescription medications for pain relief and inflammation reduction. Common examples include aspirin, ibuprofen, and naproxen. Despite their widespread use, NSAIDs are known to irritate the stomach lining, leading to the formation of gastric ulcers. Long-term use, high dosages, and combining multiple NSAIDs increase the risk significantly. Number 9. Corticosteroids. Corticosteroids, such as prednisone, are potent anti-inflammatory drugs used to treat a wide range of conditions, from asthma to autoimmune disorders. While these medications can be life-changing for many patients, they also carry the risk of gastric ulcerization. The mechanism behind this risk is related to the suppression of prostaglandin production, which plays a protective role in the stomach lining. Number 8. Anticoagulants. Anticoagulant medications, also known as blood thinners, are prescribed to reduce the risk of blood clots and stroke in patients with certain cardiovascular conditions. Warfarin and heparin are commonly used examples. Unfortunately, these drugs can lead to gastrointestinal bleeding, increasing the likelihood of gastric ulcers in susceptible individuals. Number 7. Selective serotonin reuptake inhibitors, or SSRIs. SSRIs are a class of antidepressant medications that work by altering serotonin levels in the brain. While they are considered relatively safe for most patients, long-term use of SSRIs may increase the risk of gastric ulcers due to their effect on platelet function and serotonin regulation in the gastrointestinal tract. If you have questions about your medication, we created a book just for you. 10 questions everyone should ask their pharmacist. Link down in the description below. Please check them out. Number 6. Bisphosphonates. Bisphosphonates are prescribed to manage osteoporosis and other bone-related conditions. Drugs like alendronate and ibandronate can cause irritation on the esophagus and stomach lining when taken improperly or for extended periods, leading to gastric ulcers. Number 5. Potassium supplements. Potassium supplements play a crucial role in maintaining the body's proper functioning, especially for individuals with potassium deficiencies or those taking medications that deplete potassium levels. These supplements are often prescribed to address these specific health needs, with the intention of restoring the delicate potassium balance within the body. However, while they serve a vital purpose, caution must be exercised when using potassium supplements, particularly in high doses. The potential downside lies in their impact on the stomach lining, where excessive amounts of potassium can exert an abrasive effect, leading to the development of gastric ulcers. The stomach's lining is lined with a protective layer that shields it from the corrosive effects of stomach acid. Yet, when potassium supplements are taken in large quantities, this protective barrier may become compromised. The high concentration of potassium can disrupt the delicate pH balance in the stomach, promoting increased acidity levels. As a result, the stomach lining becomes more susceptible to damage, potentially leading to the formation of painful gastric ulcers. Number 4. Iron supplements. Iron supplements play a vital role in managing iron deficiency anemia, a condition where the body lacks enough healthy red blood cells to carry oxygen efficiently. These supplements are often prescribed to replenish iron levels and improve overall health. However, while they can be incredibly beneficial, iron supplements can come with their own set of challenges. One significant concern is their potential to cause gastrointestinal irritation, which may pave the way for ulcer development. When taken on an empty stomach, iron supplements can be particularly harsh on the delicate lining of the gastrointestinal tract. The high concentration of iron in the supplement can lead to increased acidity in the stomach, which, over time, might contribute to the formation of gastric ulcers. Furthermore, taking iron supplements in high doses can exacerbate this risk, as the excess iron may not be adequately absorbed and instead can cause irritation and damage on the stomach lining. Number 3. Non-steroidal anti-inflammatory drugs with anticoagulants. When NSAIDs and anticoagulant medications are used together, the risk of gastric ulceration multiplies. The combination of these drugs can lead to severe bleeding in the stomach, significantly increasing the chances of developing gastric ulcers. Number 2. Chemotherapy drugs. Certain chemotherapy drugs, particularly those used to treat cancer in the digestive system or as part of the whole body treatment, can lead to gastric ulcers as a side effect. The powerful nature of these medications can harm the delicate balance of the stomach lining, causing ulcerization. Number 1. Antibiotics. Antibiotics have revolutionized modern medicine, offering effective treatment against a wide range of bacterial infections that were once life-threatening. However, beyond their undeniable benefits, these potent medications can sometimes bring unintended consequences. One such consequence lies in their potential to upset the delicate balance of the gut microbiome, the complex community of microorganisms that reside in our gastrointestinal tract. The gut microbiome plays a crucial role in various aspects of human health, from aiding digestion to supporting the immune system. When antibiotics are introduced, they can indiscriminately target both harmful and beneficial bacteria, causing an imbalance in the gut flora. This disruption can lead to gastrointestinal issues and, in some cases, even pave the way for gastric ulcers to develop. The stomach lining, a critical barrier between the acidic environment of the stomach and the underlying tissues, can become vulnerable when the gut microbiome is compromised. Over time, prolonged use of specific antibiotics can heighten this vulnerability, potentially allowing stomach acid to erode the lining and form gastric ulcers. While many medications provide significant health benefits, it is essential to be aware of the potential side effects, including gastric ulcers. If you are taking any of the medications mentioned in this video, it's vital to communicate openly with your healthcare provider. They can help you manage potential risks and provide guidance on maintaining a healthy stomach lining during your treatment. Remember, this information is not intended to replace professional medical advice, so always consult with a qualified healthcare professional for personalized guidance. For a more comprehensive understanding of this topic, please see the description box. We provide a list of the top 10 questions to ask your pharmacist when picking up your medication. This is not an all-inclusive list, and if you need more information, check out the link below. Welcome to Dr. Vivian Medications and Natural Supplements. Our channel is dedicated to providing valuable information on health and wellness that's made by a licensed professional. Times are crazy and it's extremely important to be well informed and taking care of yourself. If you enjoyed watching, please help us out by liking this video. In this way, we will know how well we're doing. And if you like more of these, consider subscribing and hit the bell notification to stay on top for more upcoming videos. Thanks for watching.